Hi, I'm Dr. Ghanem. I'm the Head and Neck Microvascular Surgery Fellowship Director at Henry Ford Hospital, and it's my great pleasure to welcome you and tell you a little bit about our fellowship at Henry Ford Hospital. The purpose of this fellowship is really to train a complete head and neck microvascular surgeon. So from a clinical perspective, as a fellow, you'll get an opportunity to work with 5 fellowship-trained head and neck surgeons from different parts of the, trained at different parts of the country. And you'll have an opportunity also to work with a fellowship-trained endocrine surgeon who just only focuses on head and neck endocrine surgery. There are 2 anterior skull-based surgeons also, as well as our laryngology faculty that perform a lot of transoral laser microsurgery. From a clinical perspective, you have a wide variety of advanced head and neck cancer resections and reconstruction. From a microvascular standpoint, we do approximately 50 to 80 free flaps per year between 2 microvascular surgeons. And you'll have opportunity to see advanced cases like vessel depleted neck, microvascular surgery, patients who've had previous flaps and undergoing additional kind of flap surgery, as well as more bread and butter type of head and neck reconstruction. From the other aspect of modern day head and neck surgery is transoral robotic surgery. In Henry Ford, we have been doing transoral robotic surgery since it was FDA approved in 2010, and I'm pleased to say that we have we'll be getting later this month the newest robot, which is the SP robot, which is FDA approved in our field, and that will really transform head and neck transoral robotic surgery. And as a fellow, you'll be getting trained in this new technology, or newest technology. And then I would say probably the most important thing is really learning to work within a large multidisciplinary team and seeing that team in action. So at Henry Ford, we've developed, I would say, world-class multidisciplinary care for head and neck. So our tumor board, not only do you have radiation oncologists, medical oncologists who specialize in head and neck cancer, but also we have a dedicated team of folks that includes a health psychologist, one of 2 in the country, in the US. There is a dietitian, there is a speech-language pathologist who just work with our head and neck cancer patients. So they have a lot of experience and do excellent work with counseling patients preoperatively and postoperatively during radiation. That team follows that patient. In addition, we have physical therapy that evaluates patients, especially those who are going to be undergoing free flap surgery. There is also dentistry as well as oral surgery. So you get to really work within this large kind of group and see how all of these different specialties interact with a head and neck cancer patient, and that's really modern day head and neck cancer care for patients, and this is very uniquely developed here at Henry Ford. My colleague, Dr. Vivan will go into a lot more detail about the clinical research opportunities and translational research opportunities here at Henry Ford, which I believe is very exciting. Thank you.
Hello, I'm Vivan Wu, head and neck surgeon and fellowship co-director at the Henry Ford Hospital in Detroit, Michigan of the Head and Neck Surgical Oncology Fellowship Program. Dr. Ghanem thoroughly reviewed the clinical offerings and opportunities that we have for you here in Detroit. First and foremost, we want to train thoughtful surgeons with sharp clinical acumen in the most innovative surgical techniques. But a close second to that is we want to train the next leaders and thinkers in our field. Who's going to carry head and neck cancer forward in the next few decades? As such, I think it's critically important to offer our fellows various academic pursuits and exposure to a broad catalog of research offerings. I want to reiterate and emphasize the team-based approach that we take towards the care of our head and neck cancer patients. But I also want to speak a little bit on how that team-based approach is translated into our research endeavors. Every Friday we hold our multidisciplinary tumor board, and it has the full standard panel of clinicians, including oncologists, pathologists, radiologists, but we also have a very robust supportive oncology team. Of course, we discuss pathology and management options, but we also review things such as, what's the patient's nutritional status? What's the patient's career? What are the patient's hobbies? What's the patient's support network? What's the patient's cognitive ability or his current mood? What are the patient's goals, and what are the patient's goals from a quality of life standpoint? Tumor board is where rich clinical experiences of each provider can be leveraged to identify potential gaps in knowledge. We carry that information into the second hour, where we discuss new research proposals, we update current research projects, we also review enrollment in cooperative group trials and internal trials. Our team-based approach to research has led to several successful efforts. Dr. Chang is co-PI for the NRG HN006, studying sentinel node biopsy in early oral cavity cancer. We have PCORI funding to study longitudinal quality of life data in patients with oropharyngeal carcinoma. We have internal trials evaluating alternatives to opiates for pain relief during radiation. Another internal trial studying consolidation therapy using immunotherapy after salvage surgery. Our speech-language pathologists are involved in a multi-institutional trial studying swallowing exercises post-treatment. We've looked at cognitive function and adherence to tumor board recommendations. Our dietitian is also involved in an industry study looking at immunonutrition perioperatively. The cooperativeness of our group has led to a robust biorepository of recurrent and metastatic tumors. And in addition, our faculty are adjunct faculty at Wayne State University and the University of Detroit Dental School, where we have an access to a bevy of resources that these institutions have to offer. It's a very exciting time for cancer care at the Henry Ford Cancer Institute. Our division has seen steady growth as we continue to learn from each other and our patients. We hope that you will join us.